Good morning, good afternoon, and for some, if it's good evening, we're delighted to have you with us at this public session of the Standing Committee on Emerging Infectious Diseases and 21st Century Health Threats. I'm Harvey Feinberg, President of the Gordon and Betty Moore Foundation and Chair of the committee. And on behalf of all of us, it's a pleasure to welcome you to this open session at our meeting here in December of 2021. As an open meeting, this session is on the record. Individual members of the committee will, from time to time, be expressing their opinions. And I would just alert everyone that when any member of the committee is speaking, they're speaking on their own behalf, expressing their own views. This is a time when individuals will speak. They're not speaking necessarily on behalf of the full committee. They're not speaking on behalf of the National Academies of Sciences, Engineering, and Medicine, just as individuals. So please interpret those remarks in that context. And note that our meeting as being both live streamed and recorded, and we will be transcribing notes for internal purposes just to track the comments that are made along the way. Our purpose really today is to hear from and to discuss with our colleagues, the Assistant Secretary for Preparedness and Response in HHS, Chris Hassel's with us from the Assistant Secretary's office as deputy. And Chris, it's such a pleasure to see you, and I know we will hear from you in the appropriate time, and so pleased to have you with us and working with you in this very important continuing effort. I'd like to mention to all of our members particularly that as we're all on Zoom, and we all know so familiarly by now that it does have this virtue that we're literally all on the same plane of appearance. At the same time, we cannot see everyone by the number who are with us. So if you would like to make an intervention or a comment, please, if you can, use the raise hand function. That has the virtue of automatically putting us in the correct order of indication of willingness or readiness to speak, and we'll try to recognize everyone in turn. It would also probably be prudent if you're not speaking to keep yourself on mute, as this reduces the intrusion of background noise. We have organized our session with a number of individuals asked to offer initial comments or insights on particular topics. And I would just ask everyone, in order for us to get through a very complete agenda, if we could try to stick to the allotted times for each of us. We're especially looking forward, as I mentioned, to hearing from Chris Castle, the Deputy Assistant Secretary at ASPR. He'll provide us with an update on the status of the COVID-19 response. And we're also going to hear, particularly from members of our committee, on the implications of the most recent developments with the appearance of the Omicron variant. And that leads us naturally to thinking about implications of any future emergent variant. Our plan is to have this open session continue for approximately 90 minutes. That will take us Eastern time to about 11:30 in the morning. And then after a brief break, we will resume the work of the committee in an executive session. At this time, unless I've missed any of the important preliminaries, and I'm looking, I can't see Lisa Brown, our able leader of the staff, to help us if we are missing anything critical. But Lisa, I was going to turn now to the introductions of the committee and ask members just to identify themselves by name, and institutional affiliation. That way, we'll at least hear from each who is on the call and have a chance for any of the auditing public to understand who's with us today. I might begin. I've already indicated that I'm Harvey Feinberg at the Gordon and Betty Moore Foundation, but I would like especially to welcome Gigi Gronvall. Gigi is a new member of the committee. Gigi, maybe you would start us off as a new member.
Sure. So I'm Gigi Gronvall. I'm from the Johns Hopkins Center for Health Security. I have an immunology background. I'm so thrilled to be here. Thank you.
Thank you very much. I'm going to call on members that I believe are present on the call, but if at the end I overlook someone, I hope then we'll have a chance to hear from any others. Ralph, are you on the call? I don't hear Ralph. Okay. Is Mary Bassett on the call? No. How about Georges? Don Berwick.
I'm here, Harvey. Don Berwick.
Great.
I'm a President Emeritus and Senior Fellow at the Institute for Healthcare Improvement and former CMS Administrator. It's great to be with you.
Thank you so much, Don. Great to see you. Alta?
Good morning, Alta Sharo. I'm Professor Emerita of Law and Bioethics at the University of Wisconsin and work currently in biotechnology consulting.
Thank you very much. Peter, are you on the call? Jeff?
Good morning. This is Jeff Duchin. I am the health officer at Public Health, Seattle and King County in Washington State. And I'm a professor in medicine, Division of Infectious Diseases in the School of Public Health at the University of Washington.
It's great to see you, Jeff. Thank you.
Thank you.
Ellen, are you on the call? Baruch.
Hi, I'm Brooke Fishoff at Carnegie Mellon University in the Department of Engineering and Public Policy and Institute of Politics and Strategy. So nice to be here.
It's great to see you, Baruch, and thank you so much for all that you have continued to do on behalf of the academies and for COVID. Really appreciate it. Peggy, are you on the call?
I am on the call and delighted to be here. I'm Peggy Hamburg. I'm currently serving as the interim vice president for biological programs and policy at an organization called the Nuclear Threat Initiative, actually a job I had 20 years ago, so my career may be going in the wrong direction. But most of my career has been in government service, New York City Health Commissioner, Assistant Secretary for Health, and FDA Commissioner.
Thank you, Peggy. I like to think of it as an upward spiral. So that's returning at the same vertical position, but at a higher level. It's wonderful to see you. John, are you on? How about Kent?
Good morning. I'm Ken Kester. I'm the head of translational medicine at IAVI, working on vaccines for global public health, and also professor of medicine at the Uniformed Services University School of Medicine.
Thank you so much, Kent. We're going to look forward to hearing more of your perspective as well. Patricia, are you there?
Yes. I can't. There you go. It's Pat King. Thank you so much, Harvey. I am Professor Emerita from Georgetown University Law School.
Very nice to hear and to see you, even if briefly for a moment there, Pat. It's wonderful to have you with us. Jonah?
I am Donna Mazzette, and I'm Vice Provost of Grand Challenges at University of California, Davis, where I'm also a Distinguished Professor of Epidemiology and Disease Ecology.
Great. Tara? I don't hear Tara. Is Alexandra with us?
Hi, my name is Alexandra Phelan. I'm an assistant professor at the Center for Global Health Science and Security at Georgetown University School of Medicine and adjunct professor of law at Georgetown University Law Center.
Very good to have you with us, Alexandra. Thank you. And David? I don't hear David. It's always hard to know if someone is just unable to get off mute in time or actually not here. But did I overlook any member of the committee who is here? I would love to hear from them. We have one additional new member, Nicole Laurie. Nikki is going to be with us momentarily, and then we'll have a chance to hear from her and for her to introduce herself. Now, on the staff, I wonder, let me just say, we have with us, in addition to Andy Pope. Andy, where are you? There you are. You want to say a word, Andy?
I'm spiraling upward, Harvey. Want to say hello to everybody. Great to see everyone.
In your case, Andy, it may just be spinning. It's hard to tell the difference, but it's great always to work with you. And Lisa Brown.
Good morning, everyone, and we're very excited to be kicking off year 2 of the Standing Committee and looking forward to the discussions today. So thank you all for joining.
And Emma, is Emma with us this morning?
Hello, good morning. I am. Thank you all.
Thanks, Emma, for your support throughout. And there's several additional staff, some of whom are new to us and new to a role at the Academies. Especially, it's a pleasure to welcome Monica Feit, who is the Executive Director for the Health and Medicine Division now. Monica, I know we're going to hear a word from you, but could you just say hello?
I would be happy to say hello. It's great to be here. As Harvey said, I'm the new Executive Director. I've been here for exactly 5 weeks, so ask me anything.
We'll come back to you in just a moment. We have a new Associate Program Officer, Shalini. Are you on, Shalini? Can you say hello?
Yes, good morning, everyone. It's great to be with you today.
Thank you, Shalini. And Maggie is joining as a new Research Associate. Maggie, where are you?
Hi, nice to meet you. Great to be here.
Well, thank you all for being with us and for your help enabling the committee to get its work accomplished. Monica, we would love to hear from the perspective of your new role, how you view the work of the Standing Committee. We'll take a couple of minutes then to hear also from Andy and Lisa before turning to Chris. But to start us off, Monica, first, from all of us, congratulations on this new responsibility. It has enormous scope and reach within the academies and therefore across the whole of the field of health and medicine. And we're delighted to have you with us this morning. So please feel free to introduce in the way that you would like.
Thanks, Harvey. I am delighted to be here, and it is my great pleasure to welcome you all on behalf of the National Academies. As Harvey and I both just mentioned, I am new to this role, but I am not new to the Standing Committee. I've had the good fortune of working with the Standing Committee largely through an affiliated activity called the Societal Experts Action Network, or SEAN, which you may be aware of. And SEAN is based in our Division of Behavioral and Social Sciences and Education. SEAN has worked really closely with the Standing Committee in responding to questions from policymakers where the responses are rooted in the social and behavioral sciences. It's been a terrific collaboration among the staff, among the leadership. Mary Bassett and Bob Groves co-chair SEAN, and they've worked very closely with Harvey. And I know many of you on the call have been involved in SEAN's activities. So one of the most gratifying things has been watching the way SEAN and this Standing Committee really pioneered a new way of working at the National Academies. And whether you know it or not, you all are responsible for rapid expert consultations, which are really a new thing for the Academies. And it's a way to quickly assemble the existing evidence and then succinctly respond to policymakers in a very short turnaround. And you've really forced the institution to be more nimble. And this is an enduring product that I think will live long beyond the pandemic and the Standing Committee, and really is something new for the institution. And you all are responsible for that. So it's been great to see you really push the work of the institution. It's also been gratifying to see all the work that you've accomplished, starting with how quickly you were able to assemble and respond to questions as the pandemic was really just unfolding. And as we know, your work is not over. It's going to be exciting to see how you respond to all of the conditions that we find ourselves in now. And I'm excited to participate in this meeting, to hear what the discussions are. I look forward to the work that you'll continue to do. And I just want to close by thanking you for your service, really, for the academies, for the nation, for the world. I think the work that you're doing is tremendously important, and I'm just grateful that you're all willing to do it. So thank you, and I look forward to a good meeting.
Thanks so much, Monica. Andy, we'd love to hear your thoughts as well.
I guess I should come off mute. Thank you very much, Harvey. I will be very brief. It continues to be an honor and a true pleasure to work with this group and to be able to be responsive to the needs of the Assistant Secretary's office in such a way as we have, and to begin now with a second year. Well, I guess we're not beginning. We started this second year with the FEMC report, which we'll talk a little bit about. But it's an honor and a pleasure, and very much thank all of you for your service on this important activity.
Thanks, Andy. And Lisa.
I'll keep it short so we can move on in our program. But just again, thank you all for joining this meeting at such short notice. I know it's been one of those activities where we've had to respond urgently, and we're looking forward to maybe moving into some more mid to long-term planning with the standing committee, and looking forward to discussing those types of priorities today with you all.
Thank you too, Lisa. I think it is evident to all of us that without the incredible support and intensive effort of the staff, that none of the product and effort of the committee would reach fruition, and certainly nothing like the time and quality that it has. So we're very grateful to all of you. We're also extremely appreciative of the privilege to offer the guidance of the committee to the Office of the Assistant Secretary for Preparedness and Response. Chris Hassel has been an incredibly effective ally and partner through that office in working with the committee, in guiding our effort, and also in responding to the products of the committee. Chris has continued in his service in the office in a way that puts him right at the heart of the issues of emerging infection, coping with COVID, and thinking through and preparing for what is inevitably going to be the next threat, whether an immediate new variant, a future variant, or an altogether different organism. Chris, we're really eager to hear your thoughts at this time, the issues that from your perspective have emerged as of real concern, any topics immediately that are of kind of complexity and uncertainty that you feel our work could be particularly helpful, and any other insights on the current state of play with respect to the COVID response that you feel would be relevant to us. So we're looking forward to hearing from you, and I'd love now to turn over the proverbial mic, at least to you, and we're all eager to hear. So Chris, it's over to you.
Thank you very much, Harvey. I'll see if I can deliver on everything you just promised. So it's good to see everyone again. I'm always get a little, I don't know if it's chill is the right word, but I'm very humbled and just incredibly grateful to talk with this committee. And I can't help but always mention, and some of you are getting tired of this, but you know, this all started with a phone call to Andy in February of 2020. And we were desperate to get some subject matter expertise, giving us some very quick advice. Andy pulled something together so that Monday afternoon we had a teleconference. It included many people that are on the standing committee now, but that was incredibly helpful to have some early stage input from really the top folks who could give us some guidance at this an incredibly important point in all of this. And then that led to the formation of the standing committee, and then we reestablished it again after the first year because we saw that this is going to be an ongoing need. So truly, my intention is that this will be truly a standing committee. Monica mentioned the REX, the Rapid Expert reports that we received. Again, at that first meeting that we had back in early 2020, the one I've sponsored a number of consensus reports and other efforts at the academies, and as much as I value them, the timeliness was the concern. We couldn't wait for 2 years to get the polished input back. And I'm just incredibly grateful about the response, the recs that were generated. This is long before the professional societies and the academic and industrial communities caught up with studies and publications. So those were so important. And I included a stack of those recs with the transition team when the new administration came in. So those are still continuing to prove their value. And then, as also was mentioned, the interaction with Sean and some of the other committees. My own personal viewpoint is I guess I have trouble holding a job, so I've been in several departments now, and I'm very passionate about making sure that the interagency, that the government agencies are all working together. And I also reflect that at the academies. There's so many different facets and components of the academies that the fact that everyone can pull together, and some of those things are co-sponsored, that thrills me when I see that, because it really, it's orders of magnitude, I would say, improves on what we're able to receive there. Now, you'll notice that the Assistant Secretary is not on the call today, Dawn O'Connell. She regrets that. As you remember, Bob Cadlick was rarely able to join. The intention was for her to be here, but Omicron interfered with that. But I talked to her on Tuesday. She wanted me to convey her deep appreciation to the academies for the ongoing work, and especially for the most recent PEMC study that was completed in Gigi's, I guess, the titular head of representing that here. But again, the quick turnaround on all of this is very much appreciated. And that one especially, I guess that was a hybrid. It was a consensus report that was generated in the time frame of a rec. So that's not lost on us, the fact that so many people had to put in their time for that. And we're implementing that as we speak, and more of that will come out in due time. But I'll come back to a minute, but Don is committed to being on the next call because I think at that next call, we'll really be at a place to move some of these efforts forward, and we can speak more about that. But to that end, I feel in some way we're at a bit of an inflection point in COVID and in the response to COVID. Now, that's not to say we're not still in the midst of a pandemic response. We certainly are, and Omicron has highlighted that fact very obviously. But like I said, there's many more people who are participating in the COVID response. So the academic community is publishing, the professional societies and journals are speeding up the review process, and so we're getting much more input from the broader community. Industry is participating, the professional societies. So they're all well engaged. And that's not in any way to say that this committee is not still valuable, but I'm just saying it's augmented by those other efforts. But another inflection point is there's a lot of things going on with this new administration that have bearing upon really the broader title of this committee that goes beyond COVID. If you look at the title of the committee, and we set this thing up intentionally so that it could extend beyond COVID. So it really is, what do we need to be better prepared for emerging infectious diseases and 21st century health threats? And that was made broad enough so that we could cover the landscape as we needed to. So as I mentioned, the current administration is responding in a number of ways. A number of efforts are either have been issued or they are soon to issue. In September, the White House put out, and this came out of Eric Lander's office, in the Office of Science and Technology Policy, what's called America's Pandemic Preparedness Plan, or AP3 as it's called. So it had a number of very ambitious goals for what we needed to do to be better prepared in the future. Now, along with that, we're revisiting the National Biodefense Strategy and updating that, putting more metrics in that are consistent with AP3, and you'll be seeing more about that in coming days. But it's beyond nascent. It's actually, a lot's going into that. And it should be coming up soon. Several relevant executive orders. One in particular has been called the Bioeconomy EO for some time now. The name is going to change to really focus more on the biotechnology and biomanufacturing, just to be a little more clear. That is, again, in development and should issue fairly soon. But it again gets at what do we need to do in this country to both promote the biotechnology and biomanufacturing, promote it and also protect it. So looking at biosecurity and biosafety aspects of that. You'll be hearing more about that hopefully soon after the turn of the new year. And then turning back to COVID particularly, we formed Operation Warp Speed with our defense colleagues and other interagency partners. That's transitioned to an extent, and by the end of the year, the goal is to have it transition back into HHS completely. And then we're forming a new entity that'll take that place so that we'll be able to have that readiness to initiate just much more rapid development and manufacturing and then distribution of vaccines, therapeutics, and diagnostics. Again, more about that will be forthcoming soon. And I apologize for being kind of vague, but again, we're kind of at an inflection point here. But I would also say that's why this is so important, because this is the time to shape those efforts. And those initial documents that are coming out are really more strategy. The key will be the implementation that goes with it. And that's where the input from the committee will be so helpful as we refine that implementation effort and move forward together as the whole of society, not just the government. If I can mention a few other factors too that are influencing this, again, Sean was mentioned and how important that was. That points to a number of social factors. A lot of us are focused on the technical aspects of the COVID response and what we'll need to do in the future. But so many social factors enter into this, and many of you have been leaders in that area in particular. Looking at things like vaccine uptake, masking. I'll be completely transparent. I'm on vacation at the moment. I'm in Puerto Rico. And it's amazing here how, one, the vaccine uptake has been very high, but the masking is really interesting to behold. I mean, being in Northern Virginia where, it's masking is very high and compliance is very good. It's another order past that here. And, it'd be interesting to study why is that? Just about town, you see people just without second thought putting on their mask and the kids putting on their masks. So there's something there. And I think a lot of these factors, and I know that when I look at what we'll be talking on in session 2 today, some of that will be, that's part of what will be addressed there. And really, when I look at all those things that are being suggested on that session 2, on the different perspectives, all of those are going to be important, again, to these inflection points. So one of the things I envision here is that we'll take the input from today. I think there are a lot of good ideas will be generated. We'll take that and we'll together do some racking and stacking and prioritization along with the department leadership. And then we can come back together very quickly, hopefully in the new year. I don't mean to take everybody's time for another committee meeting, but I think we could then refine all these and then come back to what the real initial focuses should be as we get out into the new year. And Dawn is committed to being on that call and be available for discussion more about that. But we can do that, like I say, iteratively offline in the meantime. Finally, I believe this has been announced, but there's a formation of another standing committee that is CDC is sponsoring. This is coming out of the CDC. This is the Center for Preparedness and Response. This is our sister organization in CDC. And we have a very close, good working relationship with them. Now that's what you're supposed to say if you're in government, but in this case, we truly do work very closely together. The missions are slightly different, but we nevertheless are very close. And Joanne Andriotis, who's going to be my counterpart as the lead for that committee from CDC, she's an old friend and very, very trusted colleague. And she and I have already spoken, and our intention is to make sure that both committees work fluidly. I think Joanna, you may be on the call this morning. I plan on being on the initial call for the other committee, and so I see that as another opportunity to magnify what we're doing together here. So I think I'll stop there. I realize a lot of what I said was, not terribly specific, but again, this is a time where I think this committee can be very influential in getting a lot of specificity to these efforts that are coming out and really making strategy mean something. I really get tired of, I've always said every time I move into a new office, my bookcase is full of strategies. But, when I ask, well, what was really done with that other than generate paper and a lot of meetings, I don't always get a very satisfying answer. So I'm committed to making sure that those strategies actually turn into planning and implementation, and we do something. So with that, I'll stop and again, express my appreciation to everyone, and especially to the committee members and to the staff at the Academies. Can't thank you all enough. Thank you very much.
Chris, thank you so much for your observations and reflections. It's pretty clear that you have a grasp very, very tightly of the range of possibilities that inform the academies have been capable of producing and inventing. And it's part of the task will be to map the right question on the right time frame and the right form of response or input that would actually be usable and valuable to you and your colleagues in the department. That's going to be the trick. It's also evident, I think, from what you've said, that this is going to be an iterative process in this first phase, in which we will be demarcating the landscape of critical challenges, not just in the current pandemic, but looking forward, and mapping against the dynamic developments within the different agencies of government of where things stand and what are the critical questions on the minds and facing the decision makers in the various agencies, and all the while working to do it in a way that is mutually informed and ideally coordinated across both the agencies of government and the response capacities across the academies. I was very taken with your early observation that the landscape of input and expert engagement today is totally different from what it was when the committee first inaugurated its efforts. And the multitude of voices and the multiplicity of inputs is both a great strength and potentially a source of, if you will, multiplicity that deserves some clarity. And so that may also represent a kind of opportunity as well as a source of additional valuable input. You mentioned Joanne Andrade. I don't know if Joanne is actually on the call, but are you on the call, Joanne?
Yes, I am. Thank you very much for including me today.
Wonderful to have you. And let me just ask if you would like to say anything from your perspective of what you're looking forward to in working with the new effort that you're standing up.
Yes, and as Chris mentioned, we do have a very strong working relationship with ASPR. The COVID response, I think, has made us all realize how much work there is to do. And as we're both in the process of responding and looking to the future and trying to think deeply about how to take in and synthesize all the information that's being generated, we thought that a standing committee might help us to really do that kind of work. And the success of this group in particular was really inspirational for us. From our perspective, so Chris and I will be working very closely together to make sure that our work is complementary and additive. And our work will focus on a lot of our programmatic efforts. What have we learned in this response that we really bake into our programs and preparedness and response activities? How do we sustain what we've built and think forward to prepare for whatever lays ahead? And also, how do we tackle some interesting yet challenging issues that we've really never faced before? And so this format of being able to reach out to a network of experts from across the country and even internationally is just a fantastic asset that will help us, I think, to better plan and rapidly respond. The one thing that we've definitely seen in this response is that speed is of the essence. And just when you think you've got a handle on something, you don't, because so many variables change. And as Chris said, there's societal and many other complexities that we have to think through. It's not as simple as the science, and the science isn't that simple. So I will just say thanks for being an inspiration to the rest of us, and look forward to working with you going forward.
Well, thank you so much, Joanne. We always can count on our core staff at the academies to keep things on track across the several different paths that are being pursued and followed. And we hope that you will enjoy the benefit of the new committee and the input that will help guide your own thinking and that of your colleagues at the CDC. And please be assured you're always going to be a welcome participant and input at the efforts that we have going as well with ASPR. So thank you for being with us today. Now, at this point, I would like to turn, if we could, to some of the reflections back on immediate implications now of the emergence of the Omicron variant of concern from the perspective of a few of our critical committee members to start us off in our discussion. I would like first, if he's available, Kent Kester, to offer a perspective on your thoughts at this very early stage, Kent, with respect to implications around vaccine effectiveness. Could you share your ideas with us at this point? Over to you.
Absolutely. Thanks, Harvey. And I just have a couple of just brief slides just to frame the discussion. Obviously, this is an evolving matter, and clearly not all the data is in. So next slide. Next slide. Okay, so as we know, this latest variant called Omicron, or B11529, was first identified late last month, and it's actually been pretty amazing how a lot of the early data, a lot of the early surveillance data flagged this as a variant of concern. A lot of mutations in the receptor binding domain, the ACE2 contact sites, as well as a number of other mutations that really lend itself to having a potential impact relating to resistance to neutralizing antibodies, as well as therapeutic monoclonal antibodies. Clearly seems to be associated with increased transmissibility and infectivity, likely related to both of these aspects. It's pretty clear that Omicron has the potential to replace the Delta variant as the major circulating variant of concern. And as I think we all are aware, the emergence of variants is a predictable outcome of continued viral circulation, especially in unvaccinated populations. Next slide. So this is just a sort of a flash shot from WHO. This was current as of 2 nights ago. I think we would all imagine that this is probably incomplete data, and there's probably a lot more Omicron out there in countries where either surveillance is delayed or lacking or non-existent. And so, but this is just a snapshot from WHO. Similarly, the next slide is data from CDC as of last night. I haven't checked to see if it's updated, but I think similarly, I think we would all agree that it's likely that it's in more states and territories, et cetera, in the US than is currently reported, and this data continues to evolve. Next slide. So it is suggested, we've seen that the current vaccines that are approved, certainly in the US, have continued to provide protection against severe disease, hospitalization, and death against a variety of variants of concern. And I should have underlined protecting against severe disease, hospitalization, and death. This does not necessarily equate to protection against infection. Early indications suggest this also may be the case for Omicron. However, the data is still really lacking. And I think many of us, if not all of us, have seen different reports in the mass media about suggestions that some of the approved vaccines may be suboptimal, may require additional boosters, again, to be confirmed. Early reported clinical data from South Africa and other places would suggest that this Omicron variant is associated with milder disease. But we have to keep in mind that this may also be complicated by prior immunologic milieu of prior COVID-19 disease, vaccination, as well as particular aspects of impacted populations. Again, unvaccinated people, especially those with underlying medical conditions, remain at high risk for adverse outcomes. And the issue of waning immunity in those currently vaccinated, I think, is a real concern. And again, with the issue of further boosters being suggested. We've all seen that evaluations of existing vaccines or existing vaccine technologies is underway, and we've seen reports in the media of the possibility of a rapid sequence developing a new mRNA candidate or candidates if needed over the next number of months. Next slide, which I think is the last one. So a couple key issues. So if our current vaccines are really much less effective, and by that I'm really focusing on prevention of hospitalization, severe disease, and death, what's the timing to develop new vaccines? And we've already heard that at least one of the companies is already working on this using an mRNA strategy. What's the interim strategy? We've seen discussions and mention in the media about the need for additional boosters. Okay, so which ones? Is it still mix and match? What is the timing? What is the frequency, et cetera? If new vaccines are required, what are the regulatory considerations? Can they be approved based on immunologic bridging, based on the data that's already been submitted and reviewed by the agencies? Or, do people still think that efficacy studies are going to be possible, which becomes increasingly difficult with wide use of existing vaccines? And then if new vaccines are required, then it invokes the whole issue of the logistics of deployment of a whole new series of vaccines, production and deployment. But the other big issue really is this is predictable. The emergence of other variants of concern, I think, this is biology. And it really raises the question, is do we need a universal or pan-coronavirus vaccine, one that is not affected by emergence of variants? And I think there clearly are some groups that are looking at this and have some work underway. But it's sort of like the game of whack-a-mole. You see new variants and you tweak a vaccine, and then another one pops up, and then another one pops up. And of course, we know that these variants will have varying fitness, in terms of their penetration into society. They will have probably varying amounts of pathogenesis or pathogenicity, which, of course, it's one thing if it just causes a runny nose, and it's another thing if it leaves people on mechanical ventilation and ECMO or worse. And in the end, it just points to the issue of whatever approach makes sense. is the developing of a broad and durable protection. And I think that's something that we're seeing right now with the existing vaccines. Is what is the durability, and if it's not durable for what we need, how do we get it there? And I think that's all I got. So thanks.
Ken, you covered a tremendous amount in a very few minutes and raised really critical issues for both immediate decision making and longer term activities. So I know there's going to be a lot of questions that this will prompt and discussion, but I would like to suggest that we hear from each of the initial speakers and then open up for general discussion that could be directed to any or cross-cutting issues as well. But thank you for starting us off in such a clear and important way. We thought it would be useful to hear perspectives on implications around risk communication and community engagement, especially with the complexity of communication around the idea of the variants and the specifics of Omicron. And Baruch, I believe that you are prepared to start us off with that reflection. So let me turn it over to you. If you're speaking, you may still be on mute.
Okay, thank you, Harvey, and thank you for everybody for the chance to speak about this. My reflections on Omicron are the same as my reflections will be on Pi and Rho and the variants to come. So my first activity with this committee was writing this report together with Richard Besser and our ABLE staff and a couple of helps. I was pleasantly surprised to see in the briefing book that this was the most downloaded activity in a rapid response report from this committee. I'd like to think it was due to our trenchant writing, but it was more due to the sort of communication chaos in part at that time, where things were poorly communicated, often poorly informed, and poorly understood. And we had this, I think, disappointing but important message that we just did not know very much at the beginning of April 2020 about the effectiveness of the vaccine. And we tried to make it as clear as possible that this was due to lack of research investment, that the lack of limited evidence on effectiveness did not mean we had evidence on limited effectiveness. This has continued to be a difficult thing to communicate. Towards the end of last year, I was pulled in by the Leeds and Cochrane, who were trying to provide perspective on a couple of large, very large, but still underpowered field tests of face masks that have produced necessarily ambiguous results. A point that we made in the face mask report was that it was vital not to speculate about human behavior, and we tried to make that point by saying that at that time there were two conflicting versions of folk psychology about face masks. One said if people wear face masks, they'll say that's all I'm going to do, and the other said, well, if people make face masks, that'll become part of their identity, and then they'll do lots of other things. So we shouldn't speculate about vaccines and variants. We shouldn't speculate about human behavior. My next chance, I had the honor to work on this committee along with at least two other people on this call. We had a fantastic committee. We produced this set of recommendations for the phases of equitably allocating a vaccine, which probably most of you have seen. It was based on these four criteria, the four simple, relatively straightforward criteria. We settled on these four criteria because the committee had, taking from the report, a commitment to transparency was to ensure that the framework is equitable and is seen as equitable. The committee designed it to be easily understood by diverse audiences, reliably translated in operational terms, and distinguish scientific and ethical judgment. So communication ability was built into the scheme itself. We had separate chapters on these two distinct but mutually reinforcement efforts. One is risk communication and community engagement, which is to provide the facts that people need in order to feel respected, to make personal choices, to evaluate programs, understand the rationale of their programs, and the chapter on health promotion, which is to provide official recommendations through trustworthy channels, along with the resources for acting on them. We describe this as distinct efforts because if you mix promotion with communication, you end up eroding the credibility of the communication because people perhaps rightfully worry that you're spinning the facts. We pointed to the scientific foundations that we have for how to undertake risk communication and community engagement. These are some of the issues that people have studied over the years and know how to do better than folk psychology or folk sociology, but sociology. We also called for strategic organization, which called for national coordination, that somebody needs to gather and analyze the decision relevant information so we know what people need to know, as well as the quality of that information. And somebody centrally needs to create and test message prototypes drawing on the sciences of science communication. So these are not these are known sciences, but they're not widely distributed. Somebody needs to develop the prototype and to test them. And that's the top-down part of it. The bottom-up part is that we needed community partners who would adapt the messages to local conditions, deliver messages proactively from trusted sources, and report on experiences and emerging issues so that we had continuing two-way communication between the people who have the big picture and the people who are in the field doing the work. The FEMCHI report, which came out about a month ago, calls for creating the kind of organization that is capable of doing this sort of coordinated communication between central and top-down and bottom-up, and calls for this kind of risk communication. So this seems like a very timely, a good time to try to get this right. So thank you.
Brooke, thank you so very much. There's some really critical, contemporary, challenging questions that emerge from this background, but I hope we'll come to those in a moment, and really appreciate your overview. I believe Nikki Lurie is back with us now. Nikki, are you there?
I am here, yes.
Wonderful. Nikki, we didn't have a chance to introduce you as we were going around, so if you would just, as you begin, take a moment just to introduce yourself, where you're based, and we would love to hear your thoughts, particularly on implications with respect to global coordination and response of the appearance of the Omicron. So it's over to you now.
Thanks. And it's really great to see so many friends and colleagues. And thank you for inviting me to be a part of this, this group. I'm Nikki Lurie. I'm currently the director of CEPI US, CEPI, the Coalition for Epidemic Preparedness Innovations, and have been also their director of emergency preparedness and response, not surprisingly. Prior to that, as I think most of you know, I served 8 years as Assistant Secretary for Preparedness and Response. And so had lots of experience and familiarity working with many of you and calling on Harvey as a guide many times, sometimes at midnight calls from across the ocean, and appreciate very much being here. So I have been involved with the CEPI response to COVID since rumors started coming out of China in late December of 2019, I guess, that this was a novel coronavirus, and needed to very quickly stand up a vaccine development response, but also to really think a lot about what's needed going forward. So as and you know, one of the things that's been interesting for me is that even though we've all come to terms with the fact, and Chris said this, I think, in his remarks, that 323 days was absolutely amazing to have a vaccine ready for use, it's still way too long. And so together with Eric Lander and OSTP and others, we've all put together this 100-day ambition for vaccine development. And I think that's worth talking about in the context of Omicron, because a number of companies have committed now to having an adapted vaccine if they can in 100 days. But let's just say from a global perspective, obviously Omicron emerged against a backdrop of profound inequality around the world, but how much of the population might have immunity either from vaccination or from natural infection. And it really complicates a lot of our ability to understand what's going on epidemiologically, but highlights profound needs to really step up vaccination efforts. It also, frankly, is occurring against this backdrop where we are shifting now from a supply constrained situation where there just hasn't been enough vaccine to a demand constrained situation globally, where in fact, we're limited by what countries want and can absorb. And that there are lots and lots of vaccines out there. In the US, we tend to think that the only vaccines are the 2 mRNA vaccines and J&J, but indeed that is not all the case, and there's huge heterogeneity around about what the world is vaccinated with. And that's a really important thing to keep in mind. It also, we're not the only country, as I think we all know, that is really challenged by vaccine skepticism and all kinds of misinformation. And so in many countries, we look at, well, why can't you just absorb vaccine? Well, we got the same problems there that they do here. And additionally, really huge challenges in their ability to understand what's coming and plan for what's coming, because countries now, high income countries, are basically donating, or might even say sometimes dumping vaccines they don't want, that have short half-life, that they've decided are less effective or whatever. And so there's a whole set of challenges there, I think, to contend with. And that's a little bit of the backdrop about what's happening. I think one thing that's been terrific has been that as they did at the beginning of COVID, WHO rapidly stood up a group and said, what's our research agenda here and what needs to be prioritized? And I would actually submit that that's something that we need to do domestically as well. We haven't done it, we need to do it. And both we ought to be thinking about how are we going to deal now with Omicron, but also how are we going to deal with whatever comes after Omicron? Because as Kent said, and we all know, continued evolution as a beginning is a given. And not only can't we be playing whack-a-mole with the vaccines, but we also don't want to be playing whack-a-mole with a research agenda every time this happens. So there are a couple of things that I think are going on that are important in our scientific readiness that I think are worth pointing out, because I'm not sure how much awareness there is of this group. You know, one is that there's now sort of something called a centralized lab network and something called an agility project, which is global, in which a set of assays and standards are developed and distributed to a set of labs around the world that have demonstrated they can run the assays with some reliability. And an ambition now, I think, would be also to distribute vaccinee serum to those labs so that they can test. However, a really big challenge right now is that we see each company testing its own vaccine and reporting its neutralization data. There is no entity quite yet that's got vaccinee serum for all the vaccines that are used around the world and can apply truth serum along with vaccinee serum to get us a little bit of a standardized comparison about neutralization data, about T-cell data, about anything else. I think that this is a work in progress. The US is able to do this kind of work for the vaccines that are available in the US and that it supports. But I think right now, the US and the world is also really curious about, well, how did Sinovac and Sinopharm perform? How about countries that have used Sputnik? How have they performed? And how about countries that are using a number of other vaccines that are authorized around the world? How are they performing, and what are the implications of that for whether boosters are needed? And if so, what the best boosting strategies are? So I think we can be readier for the next time by having these panels actually prepared and distributed around the world by having vaccinated animals prepared and distributed around the world, having a kind of scientific readiness. And then I think that scientific readiness can help us a ton with the really confusing communication that is out there around which vaccines are likely to work, and not everybody tweeting out their results, whether they're, validated or not, and adding to the incredible public confusion about not only the epidemiology of this stuff, but what should we do and when and how. So I think a little bit that's what it looks like from the global perspective. We're seeing amazing collaboration on sharing data, on sharing sequences, on sharing epidemiology. A couple of groups, in obviously WHO, Airfinity, or others are doing a great job circulating data on a once or twice a day basis on the current epidemiology. But the communications around this, as Brooke will point out, just remain a confusing mess everywhere. I think we will see a couple new vaccines authorized by WHO in the coming days to weeks. That's going to be accompanied by a whole new wave of information and misinformation as we need to deal with that and keep our eye on that ball as well. So let me stop there.
Nikki, that's quite a lot to both absorb and to reflect on for our work, and I know there's going to be some further discussion of that. As each of you is thinking about either issues or questions you want to raise, again, please indicate with the raise hand function that you would like to offer an intervention. I might begin with just a question to each of our initial speakers. And Kent, let me return to you for just a moment. In a way, as you were describing strategy, it seems like there were two complementary pathways, and I'd just like you to comment on this. One pathway is the increased specificity pathway, in which the revised vaccines are more tightly attuned to the specific configuration of the, let's say, the variant of the day, that is of the latest variant. And that relates to the point Nikki was making of the 100-day transformation, et cetera. And on the other side, there was the strategy for the more universal, comprehensive, singular solution that would be applicable regardless of the particular variant within a family of viruses such as coronavirus. Could you comment on these alternative strategies? Do we need to pursue both in parallel? Are they complementary but different in timing? How do you parse the effort around these two very different response strategies?
Yeah, I think, Harvey, I think you've really seized on a critical issue here. As Nikki suggested, as a multiplicity of variants emerge, and I'll use that to characterize variants of concern, not just random mutations that don't really change anything. I think it's pretty clear that the technology is out there to refine existing vaccines. It takes time, it takes money, and there has to be, especially if the variant really is significantly important for public health, there are the other sort of downstream impacts, regulatory to get it through, production, deployment, et cetera, et cetera. And so, that obviously can be done, but if this is going to go on and on and on, we can't keep hijacking, the system, to just keep every few months to adjust vaccines. I suppose if things were more predictable, it could be more like the influenza model, where there's good data, that focuses on antigenic shift or antigenic drift, and vaccines can be developed. And as we've all seen, in some years the match is better than others. that's a more of a predictable problem. And I think what we're seeing with the current SARS-CoV-2 is that it's not predictable, at least not thus far. So it really then, if one takes a step back, and again, this is just personal opinion, if one can develop sort of, a vaccine strategy that is variant agnostic, that can target areas of the virus where, these mutations are irrelevant, I think it would really help us kind of put this past us, or at least put it on the side. But again, as we've seen, the major efforts right now have been focused on specific viral types.
Yeah.
And of course the urgency, it's in the media, the hospitals are filling up, we need a new vaccine, we understand this. But if we could then also focus some resources to sort of take a step back and try to address this holistically, I think the effort would be well served.
This could relate back to Nikki's point about a coordinated, thoughtful, proactive scientific strategy. So we may come back to that. Baruch, I would be very interested in your comment on what is obviously a very contemporary and contentious issue. When you were speaking about community engagement and acceptance of vaccine, you referred to some of the efforts around enabling individuals to feel respected, to make personal choices, empowering them with information that is as unambiguous as the facts allow, and giving them the data and other elements they need to make their own choices. Today, we're in the midst of what is a highly politicized discussion about mandates for vaccine, whether it is for a federal mandate to employers around the country, or other mandates for cities, for other individual companies, etc. The question I would like to ask you is, setting aside, if you will, legal authority and political implications from the vantage point of acceptance and use of vaccines, what do we know, if anything, from the behavioral literature about the role of a requirement as opposed to information? And could you comment on that from really if you will, from a behavioral science vantage point, not from a political or legal standpoint?
No, thank you. So one behavioral, so people would like to have, let's say, experts or the officials need to earn warranted trust. A way you earn that trust is by giving people the information that they need proactively. As maybe Alta will say, the vaccine report last last September said we were late already in preparing the public for the vaccine. We have not as yet developed a comprehensive communication program to get the facts out. I think much of that trust was ours to lose. There were always going to be people who were going to oppose it. A common bit of folk psychology among experts is that the public can't handle the truth and can't understand the truth. That leads to not communicating, in which case somebody else fills the void, or communicating in an ad hoc way, which also leads to eroding trust. So it's tempting to communicate badly. We all do this, and then blame our audience. So these are empirical questions. What do people want? And I think that rather than trying to earn back trust, that I think the problem that we ought to consider is, how do we get ahead of this, earn the trust, develop the systematic risk communication program, so we don't have to spend hundreds of millions of dollars trying to overcome vaccine hesitancy, untold political capital because the leaders are not trusted. Health effects of people who haven't understood it. So I think we have abrogated our responsibility to earn people's trust by gathering, analyzing, and communicating the facts. So I would rather focus on that than on trying to dig ourselves out, worry about digging ourselves out of this particular hole.
Great, thank you, Baruch. Alta, I see that you were first, but I noticed that Chris also would like to comment. With your permission, let me turn to Chris, and then we'll get back to you, because Chris, we'd love to hear your thought or question or reaction.
Yeah, but I always like hearing what Alta has to say. So, but I'll just for the second time. I remember Nikki and I had this discussion months ago when she and I took a walk in Washington together and talking about the communication aspects of all this. And as a scientist, I have in my mind, a way of communicating things, but, and I agree with everything was just said, but, or maybe in addition, we've seen that showing data alone doesn't get the message across to the non-technical world. And in some ways, there's actually a distrust. The more bar charts and graphs and spreadsheets that we show, there's actually diminishing returns on that. And my perspective is a lot of studies that are done, but I also have to say my own extended family and probably the epicenter of hesitancy on these issues. This is why I focus back on the Sean work that was done, trying to bring in other people in the community to talk about these things, and getting communications experts and even marketing experts involved to work with the scientists and practitioners and medical practitioners to try to see how we can work together. We've done some of that, but it's nowhere near complete. The challenge we have before us is we're putting forward some very, very ambitious goals. The 100-day goal for a vaccine that was put forward in the AP3. Part of the hesitancy issue is people were saying, well, the vaccine was developed too quickly. And is this going to exacerbate that if we move it from 300 down to 100 days? How do we keep a pace with that so that the advances that we make in the timeline for provision of vaccine doesn't overrun the communication aspects? I think that's got to go hand in hand. Yep. And I'm not disagreeing with anything that was said, but that's just got to be done along with that. We can talk more about that as we have time. I don't want to take all the time. I will say though, the variant agnostic approach, I would say that may be something worth exploring further. I could get more of my NIH colleagues engaged on this, who are looking at this very issue along with some of our people. That might be something worth considering to put on the list for prioritization and consideration. So with that, I'll turn it over to Alta. Thank you.
Well, thank you very much. Alta, we will go to you, then back to you, and then to Nikki.
Sure, thanks. And I'm always happy to wait, no problem. I raised my hand, Harvey, when you began talking about the politics around this. And I wanted to ask a question that's similar, but not exactly the same. Regardless of the quality of the public health measures and the vaccines and the public education efforts, we've been suffering domestically from an overlay of political partisanship that has eliminated the notion that part of being a patriotic American is that you worry about other Americans. I mean, something really fundamental. And a lot of our communication, Baruch, has been forward, you were talking about educating the public, but this is a different kind of communications problem. And I wondered if there's anybody who's actually trying to work on how to tackle that angle, that aside from electoral politics, how to tackle this kind of underlying transformation of what used to be a kind of communal sense of us kind of all being in it together. Because if that were not there, we'd still have all the traditional problems of vaccine hesitancy and lack of trust in experts, but those are at least familiar problems as opposed to what we found ourselves in this particular pandemic. That, and then later, Nikki, I'd love to talk hear about you more about the transnational ethics issues for the trials that you talked about. But for the moment, the communications problem really caught me.
Thanks, Alta. Baruch, there's been a number of comments that you may want to react to and add to. So please, over to you.
Sure. So, we can't trust our intuitions about what communicates. The charts we create, the facts that we present may not be the facts that people need. They may not be presented in a credible way by credible people. Again, I think we can, we have failed in our duty to inform, of gathering the facts, analyzing them, communicating to them in a credible way. And I think that giving up on the public is, will increase and being perceived to give up on having given up on the public, to speak to them in a disrespectful way, which I think which characterizes many of our health promotion efforts, I think furthers the problem that Alta was talking about. So I think we need a disciplined risk communication to have the basis of understanding, so that we don't lose the people. I mean, how many of us have talked to members of our own family, people who trust the people on this call and are massively confused about what they should do, how they should run their lives. So we have failed, and I don't want us to be blaming the public on that. These are empirical questions, and we haven't taken a scientific approach to them. And just briefly to Alta, there are people working on that, and it's not my expertise, but we could certainly we could pull them into the discussion.
Thank you, Baruch. I do want to turn back. Nikki, did you have a point you wanted to raise earlier? And I believe Jeff also may have a comment, but go ahead.
No, I think that most of it can wait, and I think Baruch just said it. But again, as we think about whether it's Omicron or the next variant or the next thing, part of our checklist ought to be, we need to kick off how to get good scientific, whatever we want to call it, information about the messaging and the communication and what the public is confused about and all those things, like starting day one. And we can't stop. It has to just be adapted over time, and that we still have a huge proportion of our enterprise that doesn't think this is science.
Yeah.
And I think it's maybe just a big problem. And so then maybe just to Chris, in your question about the 100 days, obviously the communication around this has to go hand in hand, and it's only 100 days if you've got a situation that is so dire that there are things you have to do that you might not have contemplated doing before, but you've got a high degree of confidence about what you're doing. And we could talk about all that later if you want, or offline.
Yeah. I hope we can come back to that issue. Just as a quick aside, I've often felt the communication is not about how quickly the days went before the vaccine was authorized. The communication should be about the millions of people who've already gotten the vaccine and what we now know about both the protection and degree and frequency of any side effects. And if we reframed and rethought the question of speed, not in terms of how many days pass, but rather how many people have already experienced this and we can learn from and you can gain confidence from, I think it would reshape the way one thought about is this a proven or not yet proven intervention. But anyway, this is a topic I hope we can come back to. Jeff, did I see correctly that you wanted to intervene and offer a comment or question?
Well, I would thank you, Harvey. I would just say that this is something that we in public health are dealing with on the front lines every day, and it is a tremendous challenge for us because of the complexity of the audiences, the varied audiences, the various factors that influence their receptivity to information, and the interrelatedness of both, the vaccine, the other mitigation measures. And I think our fundamental problem of trying to change hearts and minds with words rather than actions. And I think there's a lot of history involved in the relationship between the public and the healthcare system and the public health system that influence the receptivity to even the best well-crafted messages. I think one of the priorities now is to help the public understand what to expect about the future of this pandemic. I think there was a lot of expectation around vaccines and we're going to get out of it and, flatten the curve and we're going to be over this. And I don't think we've reframed that issue either. So I just wanted to throw that out there.
Really important observation. I can't help but reflect on a kind of thought experiment. Suppose that instead of a nation dealing with a crisis of a pandemic and trying to get vaccines out, suppose we were a soda maker who was trying to market a new orange flavored soda. And we had the ambition that every single person in the country was going to want to purchase that soda. Well, we would be testing, A/B testing, market testing intensively in every segment of the society that we cared about as our market. We would separately test in young people, in old people. We'd separately test in communities of different ethnic and racial and socioeconomic background. We would separately test in every immigrant community and everybody that we were interested in buying this soda. And we would have an intensive dossier of comparative data on what experience, connection, communication, strategy of interaction worked and what didn't work. And we would do it in a way Baruch encourages us not to depend on theory, but to do the empirical studies and actually find out in today's world with all of the history that Jeff is talking about and all of the experience that people have had with the health system. Do they trust it when Christie is explaining why he has taken the vaccine, or in fact explaining what happened at the White House at the meetings where he got infected? Is that more effective, and with which groups, etc.? So I think that we honestly have not thought about the challenge of acceptance of vaccine in the same way we would if we were marketing a commercial product, that we would have intensely prepared the way for everyone to buy that product. But now, Chris, back to you. Oh, you froze on my screen. Chris, are you there? Do others hear Chris, or am I the only one? No. Maybe whenever Chris can maybe reconnect or get to there. Oh no, I think he may be reconnecting. Let's hope. In the meantime, we have opportunity for other question. If I could, Nikki, I wanted to come back to your very exciting model of standardized, globally positioned standards and reference centers. At this stage, what would remain to be done to bring that to reality? Do the technical capacities already exist? Do the scientific networks already in place? Are the commercial manufacturers of vaccines prepared to play? Do the government-to-government relations support this activity? Is WHO the right coordinating center, et cetera? Could you give us a little more flavor of how far are we from this ideal that you described that sounded so appealing?
Well, on the one hand, I think we're pretty close. On the other hand, we're still, far away. And I think, from my vantage point at CEPI, we started some of this work actually pre-COVID, recognizing that if you wanted to develop a new vaccine against a disease, you had to have an awful lot of stuff pre-positioned and ready to, and ready to go when something happens. So we started developing this lab network. We started to develop international antibody standards against which a vaccine against various pathogens could be tested against. And, NIBSC has served as that coordinating center. I think it has a new name, but it served as that coordinating center. And they are the developer of an international standard for WHO. So when COVID started, one of the first sort of things that we decided to work on the development of that international standard, it involves going in and collecting serum from recovered people. We'll all recall that in the very beginning, we couldn't get virus or access to specimens out of China, but as soon as things became more globalized, it became relatively straightforward to do that work. So we've moved from there to this international sort of lab network and animal model network. We still need more representation in parts of Latin and South America and parts of the Sub-Saharan Africa region for sure, but I think we're working on that. I think the capabilities exist, the scientific capabilities exist, the desire and hunger of scientists and countries is there to do that. But I think that there's also just kind of a little bit still sort of a lack of vision and coordination. So even though everybody knew that a variant was going to happen, I'm not sure yet that everybody was really quite ready to think about, well, what would you need to do to be ready to test? Mm-hmm. And, it's not necessarily clear to me that all the companies or the countries have much of an interest, for example, in collecting or making available standardized vaccine serum from their trials or whatever, so that you could do this quickly. But one could certainly think about this being a contractual requirement for procurement of vaccines or for fundings of vaccines or for trials going forward. I don't think it's hard to do the animal network part of this. The harder part, quite honestly, and Alta started maybe to ask about this, is a little bit still the clinical trial networks that you really want to have in place, and the concepts of the standardized protocols. And when you think you can move from, a placebo-controlled trial of a single agent to trials of multiple agents to ditching the placebo to all of those sorts of things. And in this situation right now, we all know we still also don't have a correlate of protection. Everybody's talking about neutralizing antibodies, but it may well be, as I think we all appreciate, that neutralizing antibodies aren't really the right measure either. And, those are gonna fall rapidly. But I think that there's good international discussion and coordination. I've been super impressed that WHO and CEPI have been running these, they sort of call them SWAT teams with manufacturers and others on a maybe every 2-week basis to look at what the important scientific questions are that have to be asked and answered. Most people come to the table and present information and data and needs. And separately, there's a regulatory advisory group that has pulled together almost all the global regulators, takes the questions that the developers has, works them through with the regulators. ICMRA has stood up and is working well. I think in the US, we just have almost no visibility into the fact that most of this stuff has been happening. And I think because the US was just sort of so absent for the first year of this in many ways, we've got some blinders on, even though many of our US agencies, parts of NIAID, parts of CDC, FDA has played a huge role, et cetera, have been involved. So I'm excited a lot about the potential there. And I do think that pre-positioning all of these capabilities, both for variants in the future and for diseases in the future, is very well within the realm of the possible right now.
Well, it's very exciting to hear, Nikki. Thank you for that additional input. I'm really pleased, Chris, to see you back. I don't think we did anything to interrupt your participation, I hope, because we're eager to hear. So please, let's turn back to fittingly. This will be our probably our way to wrap up our public session now. So let me turn back to you, Chris, for your additional thoughts and comments.
Okay, thanks. So I may be biased a little bit. My technical background is in multivariate statistics. And so in a lot of ways, I view this whole COVID issue as a master multivariate problem. And how do we deconvolve all these different factors and move forward? And, you know, one of the things that has really occurred to me, both from what Alta and Nikki and Jeff and others have talked about, you know, we've been talking about some of the international work now, which with this administration, there's more of an appetite for doing that. And so it's a great opportunity to move forward with some of these things with our international partners. The focus has been on technical issues and testing and others, but I think there's an opportunity to work with some of our international partners on the communication issues and the societal issues. I was speaking early this week with a colleague from Switzerland, and you know, the vaccine uptake in Switzerland is around 65%. That just kind of busts the stereotypical view, I guess, I have of the Swiss society that there would not be so much hesitancy there. So what are these issues that are going on? And then if you look at, you know, the underserved communities and you know, I'll just be blunt, our constituency is, you know, in public health includes the political aspects that are being so hesitant right now and have been consistently. So how do we break through that? So I think there's an opportunity here, and again, maybe some of those international partners could help us deconvolve some things such as the political issues or some of the underserved community issues. You know, I'll stop there, but I'm just excited about maybe in some ways convolving some of these points, and maybe then, because that's actually a fundamental issue of design theory, is sometimes if you make a problem worse, it actually, the solution pops out. So that may be something that we could explore further, but I'll stop there. Thanks.
On your very last point, Chris, I've been working on that hypothesis of making the problems worse all my life. And sometimes maybe it works. Oftentimes it just seems to mire me in greater complexity. But we so appreciate your comment, but also everyone's input on this open discussion. Before we wrap up this public meeting component, let me just ask Lisa or Andy if there are any other elements right now that we need to cover in the public session. Lisa, I see you shaking your head. What I'm going to do then, Andy, you concur?
I'm shaking too. Yeah.
We're good. Okay. What I would like to suggest is that we conclude our public session now. We're going to resume as a committee only in our executive session. We're going to be covering really two main themes. One, of course, is the future agenda, repositioning the committee based on what we have learned, where we are, where the pandemic is, but also more broadly thinking about the future of emerging infection and the roles we could play. And then we do have an important discussion of conflict and bias that is obviously an important component of any Academy's activity that we'll turn to before we wrap up this last meeting of 2021 and prelude to 2022. What I was going to suggest, take the prerogative of the chair. I have 35 past the hour. I would like to suggest a 10-minute break for stretching our legs, doing whatever we would like for the moment. And let's resume on this same channel at quarter to the hour promptly. And we'll then pick up our next session on the work of the committee. If that's agreeable, let's take that break and come back in 10 minutes. I'll look to see you then.